We are so lucky here to have, and I think it's really exciting that you wanted to do this, Katie Neff. She's a third-year medical student from University of Michigan. She grew up in the San Francisco Bay Area and attended UC Berkeley, where she studied integrative biology. And she is planning on applying for a residency in OB-GYN and is passionate about reproductive justice. So she's going to review the intersection of reproductive and environmental justice, particularly looking at the impacts of pollution, toxins, and climate change on OB outcomes, and the role of healthcare providers in mitigating these impacts. So I will hand it over to you, Katie. Thank you so much.
Thank you all for having me today and for listening. I'm really excited to be here and to meet you all virtually, and happy Earth Day. Let me share my screen. All right, so today, as Lisa talked about, I'm going to talk about reproductive and environmental justice. So reproductive justice is a movement that was started about 80s and 90s, and it's defined as the human right to maintain personal bodily autonomy, have children or not have children, and parent the children in safe and sustainable communities. And that last part, I think, is particularly important for the repercussions with environmental justice. But like I said, reproductive justice is a relatively new movement, and it was started by a Women of Color Reproductive Justice Collective, and they really focus, like I said, on bodily autonomy. And the group that started was Sister Song, so that's just some background. And I'm sure many of you are aware and have done a lot of work in environmental justice, but just to review, that definition is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And as you know, this movement has really been picking up in the last couple of years with the focus on climate change and how that differentially impacts different communities. So some of the intersections that I thought a lot about when I was doing the research for a literature review and this project was that the environment impacts so many aspects of reproductive health, including infertility, obstetric outcomes, neurodevelopment, and cancer. And pregnant women in particular have a uniquely high risk to some of the environmental factors, just because their body is changing and growing, and the fetus is also particularly vulnerable as they're developing. So I think it's an interesting population and one that we should definitely think about when we're thinking about environmental concerns. And in particular, the justice aspect, as we know, these exposures affect groups disproportionately, creating inequities and injustices that are also important to focus on. So I did a pretty extensive literature review, and I focused on a few different areas. And the three that I found the most substantial literature on were air pollution, toxic chemicals, and climate change. So I'll briefly go through some of the landmark papers that I found, reviewing the impact of those on obstetrics. But like I said, it's not limited to obstetrics. There's obviously so many different impacts on like gynecological cancers and, as you all know, health in general. So for air pollution in particular, there was a study done in 2019 that found that nearly 500,000 newborn deaths worldwide were attributed to complications from exposure to air pollution, which I thought was a pretty astounding number, and something that I didn't know before looking into this research. So this was a study done in 2016 that looked in particular at the United States, and it looked at the association of preterm birth attributable to air pollution in particular. So I thought this was a really nice map that showed that data. And as you can see, the bigger cities in particular are disproportionately impacted by the effects of air pollution. And preterm birth is an issue because it can cause a lot of lifelong difficulties, such as cerebral palsy, issues like ophthalmic ophthalmologic issues, etc., like neurodevelopment issues. So really something to be aware of and try to avoid if possible. And as you can see in Michigan and Southeast Michigan, which is, I'm in Ann Arbor, is a darker area. So a lot of preterm births in Michigan can be attributed to air pollution. And this is another study that was done more recently in 2020 that also looked at air pollution and heat exposure with preterm birth and low birth weight, as well as stillbirth in the US. And it found really strong associations with preterm birth. It increased the risk 52% for asthmatic mothers in particular, which I think it's at an important point because, like I said, different groups are impacted disproportionately by air pollution. And so this just really illustrates that people with prior conditions are going to be more impacted by air pollution more so than other people. And then low birth weight was also an increased risk if you're close to air pollution or solid waste plant, as well as stillbirth was increased 42% with a high third trimester exposure. So who is exposed most to air pollution? As many of you know, people of color are disproportionately impacted to living in areas of high air pollution. This is due to many factors, but some of them are like redlining, which I'll get into in some slides after this. But low income is also a factor that increases your exposure risks to air pollution. One example that I think of in particular, as I mentioned, I'm from the Bay Area, and a part of the Bay Area has a Chevron plant in Richmond, California, which is disproportionately very high person of color. And the rates of breast cancer are also very high in that area compared to across the Bay in Marin, which is a much higher socioeconomic area, also happens to be more white, and the rates of cancer are way lower there, and the air pollution exposure is almost nothing. So that is just one example of things that you see across the country. As you know, Detroit is a really good example of that as well. Detroit compared to Ann Arbor, there are huge disparities there. So redlining is one reason that these disparities may have happened. Redlining, it was when in the early 1930s and 40s, cities were mapped out according to risk by a homeowners loan corporation, and neighborhoods were deemed hazardous if there were higher proportions of people of color, even regardless of economic status, which really led to these differences in race and exposure to air pollution. And now has had downstream effects almost a century later, where communities of color are more likely to be exposed to air pollution. And this is a map on the right of Detroit. There's a really good website by MSU that has a bunch of different maps for all the cities in Michigan if you're interested in looking at them, which shows the original grades that were given in the 30s and 40s, and now tracks to the current the percent of people of color living in those areas. So there's a screening tool that I found also to be really interesting for air pollution, is one of the factors that it looks at in Michigan. So this is a screenshot that I took from the screening tool for environmental justice, and it has, you can like go click over an area of the state, and then it'll give you information for that census tract and give an environmental justice score and the breakdown of what leads to that score, which I think is really interesting. So I took a screenshot of Detroit, and you can see inner city Detroit has a high environmental justice score, which correlates to like poor outcomes. And a few of the things that are factored into those score are the ozone score, which is 53%, and the particulate matter is also 91%. Versus if you look at surrounding areas that are green, they have lower environmental justice scores, which means that they are not as exposed to air pollution. And their like poverty score and unemployment score are also factored into that. So yeah, Wayne County is the one that is highlighted here, and it has a really, really high degree of air pollution, which correlates closely to the historical redlining that I was discussing previously. So a few studies have been done looking at all of this together, redlining, green space, and preterm birth. So all of these factors interplay with each other closely, and neighborhoods that were assigned those worst grades in the 1930s are now associated with reduced present day green space. So there's like a lot more cement factories, things like that. And higher residential surrounding greenness is associated with better fetal outcomes and higher birth weights. So areas that had better scores back in the 1930s now have better environmental resources surrounding them. So there's higher odds of preterm birth and small for gestational age with the worst scores. So these impacts are still being felt very much today and have impacts on obstetric outcomes. Other important things to consider are toxic exposures. So the first evidence from this came from DES, which is a synthetic estrogen that was used from the 30s to the 70s to prevent miscarriage, but it was found to have really negative impacts on reproductive health. So this has kind of been the model for us learning about these endocrine disrupting chemicals that are now just found like everywhere in the environment. We had a lot of studies from this because it was given iatrogenically. And that kind of taught us a lot about estrogen exposure and how it impacts people's reproductive health. So it has since been shown to cause spontaneous abortion, uterine malformations, and cancer, and has a lot of impacts on health, as you can see in the study on the right. So lead is another thing I'm sure you all know a lot about being from Michigan. It's well known to impact development in children, and among pregnant women, it has a lot of important outcomes such as preeclampsia, low birth weight, impaired fetal growth, and spontaneous abortion. It's also really important, obviously, to young children who are growing because their nervous systems can absorb it, and they'll have long-term intellectual disability and things like ADHD. So lead is disproportionately found, as you all know, in areas that have this historical redlining. So environmental justice is a really important factor to consider when thinking about lead exposure. Like I was saying, women of color have been shown to be exposed to higher levels of lead during pregnancy, and it continues to be an issue in Michigan as recently as this last November in Benton Harbor. I don't know if you all heard about that. But they were having a lead crisis in the town over, St. Joseph, that's 85% white, was not having that issue. So this is like a classic example of environmental justice and lack thereof and the impacts of people. So I'm sure you're all aware as well about Flint in that crisis. So other endocrine disrupting chemicals that are really common in the environment are phthalates. Those pop up in things like plastics products, cosmetics, and personal care products, medications. And like I was saying, the endocrine properties in those can affect reproductive health in particular and cause recurrent pregnancy loss and increase the risk proportionately to exposure. And again, I'm sure you all know about this as well, but I thought it was really impactful when I was doing this research in October and November. Very recently, over 200 medical journals had jointly stated that climate change is the greatest threat to public health, which is very powerful and underscores the importance of all of this work and research. So climate change in particular also has impacts on pregnancy. Heat waves have been shown to be dangerous to pregnancy, but as this is a developing area and it's happening fast, we don't get any training in this. Like I don't think I've ever had a lecture in medical school about climate change. And it's something that's going to impact our patients more and more. And as I've been mentioning this whole presentation, it of course affects people differently. So there's been another study that has shown that climate change has been affecting Black mothers the most. So high temperatures and air pollution affect people in different ways based on where you live and your risk factors. And that has been shown again and again, but we aren't really being taught about it. So climate change, of course, can cause a lot of different things, but some of the important considerations are heat waves, wildfire smoke exposure, and high temperatures, which have negative impacts. The most relevant being preterm birth, low birth weight, stillbirth, and neurodevelopment. As I mentioned, I'm from California, so the smoke has been a really big issue. And being pregnant, like I said, you have different considerations like your lungs, you have less reserve. So like asthma affects pregnant people more, and so would wildfire smoke presumably. So something to think about as the environment is changing. In Michigan, we are projected to see a 5-fold increase in heat wave days by 2050. And in Detroit in particular, this graph shows that the average temperature is getting hotter and hotter each year. And that is likely going to be disproportionate again in Detroit versus other places because of the lack of green space, the cement, the factory surrounding. So all different things to consider. So the role of healthcare providers, what can we do about it? There are a few different things that you all, I know, are aware and already doing. But to underscore, we can try and work on education, patient care itself, and then advocacy, I think are some of the main ways that we can have an impact in these spaces. So ACOG is the American College of Obstetrics and Gynecologists, and they put out a committee opinion in July 2021 about reducing prenatal exposure to toxic environmental agents, saying that basically it's important for clinicians to know about these things, and clinical encounters are a good space to screen and counsel patients about these risks, especially in the prenatal period, and in particular, individuals most disproportionately affected, which I thought was cool that they acknowledged that there's a justice element to this. Some more studies have been done to underscore the lack of training and education in this area. In particular, a survey of ACOG attendings found that 78% of respondents agreed that they can reduce patient exposures by counseling, but 50% reported that they rarely take an environmental health history, and only 1 in 15 reported any training on the topic. So it's clear that we're not really doing great in this area. So just briefly to review, there are different elements to taking an environmental history and counseling patients. Some of the most important are workplace, so thinking about metals, solvents, radiation. You know, we live in Michigan, so a lot of people work in factories, like at Ford. And then home exposures are really important too. Like, for example, I live in like a 100-year-old house in historic Ann Arbor, and I didn't even know until I was doing this project that there are so many different exposures that are associated with that. So a lot of old homes that come with lead exposure, smoking, pesticides, mercury, cleaning products, personal care products in proximity to traffic and power plants. And then food is also important to talk about. So fish intake, produce, whether it's fresh or not, if they have access, and food storage. So there's a lot of good templates online for taking environmental history because it's a lot of information. I think it's easy to forget some of the aspects that are important, especially if you haven't really done it before. So I've tried incorporating some of these different templates, and there's a lot of different good ones that I found. UCSF in particular has a lot of good resources on their website, but these are some example questions. And then, like I said, a lot of different ways to counsel and topics that are important. One in particular is food. So just cleaning off food can reduce a lot of exposure to PFAS and pesticides, and then avoiding plastic containers as possible. So these are just some examples of really quick counseling things. Like, I think it's intimidating if you don't know about a topic as much to try and incorporate it into your practice, especially when visits are so short. But I think it could be pretty easy to try and just do small things every visit, especially in the prenatal space, since providers are seeing patients so often. It's a really good opportunity to just every visit quickly be like, are you doing this? Here are some things that we could do to reduce your exposure risk. But any provider, I think, could do that. And then regionally, water, there's a lot of resources out there as well that I found. So in high-risk patients, checking a lead level is a good idea. And I found some really cool programs in Michigan And there's free lead testing kit for Ann Arbor households that everyone has access to, which I think is really cool. And there's probably similar things in different cities. And then air, airnow.gov is a local air quality. And then we can advise patients to avoid going outside during peak levels of pollution, such as during peak commute hours, especially if they live in cities, which obviously can be hard to work around, but something to think about. And then using an air filter could be a good idea as well. I know my parents still live in California, so they got one of these for their house when all the fires were happening. And then I also found some really cool apps out there, which I hadn't previously known about, for choosing home and personal care products to try and avoid these exposures, which is, again, is especially important in pregnant women. So choosing fragrance-free is a good way to avoid phthalates. Even if it says unscented, they can still have harmful chemicals on there. So fragrance-free altogether is a better option. And then using non-toxic cleaners, avoiding pesticides, and obviously avoiding smoke exposure is important. But yeah, some of these apps are really helpful. You can like search products and see if they're verified or what kind of exposures might be in the products. So some of them are called Think Dirty, Shop Clean, and then EWG Healthy Living. And you can even like scan products, which I thought was really cool. So this is just an infographic about ways to avoid toxics during and after pregnancy. Obviously, like I said, these are important for pregnant women, but helpful for anyone really when we're thinking about our exposures and counseling patients. But yeah, plastics, BPA, PFAS, mercury, pesticides, phthalates, lead, and flame retardants are all things that we can avoid. And then workplace, something I think important to keep in mind when trying to advocate for patients is that pregnant women cannot be discriminated against in the workplace, and they have a right to know. So there's a lot of different fact sheets on the CDC website, which are useful. And physicians can be really important advocates in this space by writing notes to employers to assist in obtaining accommodations. And again, this can apply to many different patients with different conditions, but obstetrics was the one that I was thinking about in this case. And I already mentioned some of the food considerations. Of course, it's always good to try and avoid fast food and processed food, but there's a lot of environmental justice impacts with that as people don't have access to, grocery stores and fresh food. So there are different programs that I found in Michigan as well. Like WIC is a really good one, and the Michigan Food Assistance Program is also a really strong one to try and increase access to fresh food that has less potential contaminants. And then, as I mentioned, heat is an important thing that can have preterm birth implications in stillbirth. And as the temperature is rising more and more, it's important to think about this. But using air conditioning, avoiding sun exposure, and limiting outdoor activity. And another cool program I found is energy assistance, like with DTE, is often available for low-income families, which I didn't previously know about. And as you all are aware, advocacy is a really good way to try and make a bigger change because, as we all know, this is a systemic issue, and it's important to think systemically to try and affect change in these spaces. It's good to, in my opinion, I think it's important to try and make individual changes, but in the end, systemic stuff is what's going to actually change the national and regional space. So I think that's very important to think about. And these, of course, are local organizations that are good to be involved in all the different ways that you already all are. And I have a lot of different resources linked. I can send out the slides if anyone would be interested later. But yeah, thank you all so much for listening, and I'd be happy to talk about any questions or anything like that. And I appreciate your time.